Hello everyone, today's video is just an update about the pandemic that we're currently in, and I'm doing this in the middle of May. And so, as my usual disclaimer, remember things are changing rapidly with the virus as far as the amount of information we have and the recommendations we have. So this is just a current update. So I hope you guys are following some of my previous advice and trying to stay on a daily schedule. I highly recommend waking up at the same time, make your bed, get your clothes on, have a project to accomplish each day so that you feel useful. We've tried writing a children's book that's currently under production. We're very excited about that. I just learned how to color my own hair at home to cover all the gray. That's pretty exciting. So there are all sorts of things that you can do, but I want you to keep each day on somewhat of a structure, particularly encouraging outdoor time, both because it's good for the mood, it's good to get out of the house, the light kills germs, and vitamin D that you can make through sunlight exposure to your skin can increase your immune system's response to any germs you might come across. So update for pediatrics specifically about this pandemic. One of our largest concerns from the American Academy of Pediatrics and the North Carolina Pediatric Society is that already there's a documented decrease in vaccination rates of children. Guys, this is a huge problem. Just because we're all focused right now on COVID-19, it doesn't mean that the other bacteria and germs and viruses aren't still out there and ready to attack your child. So I just want to encourage you to come into your office, your pediatric office, to get your child vaccinated on the usual schedule. Now, I can tell you what we're doing where I work, and that is in Clayton in North Carolina. We are still doing a lot of telehealth visits for mild illness or for a recheck of a chronic condition like ADHD or even some asthma we can do on one of these visits, or anxiety or depression or mild rashes and things like that. Now, for any severe illness, we're still also doing a drive-through clinic in which our providers are completely covered in personal protective equipment when they see your child, and we can still do diagnostic testing in the drive-through clinic. So I want to assure you that indoors where we see our well visits, everyone is having their temperature monitored twice a day, all the staff. We will have goggles, eye protection, we will have masks on. In fact, now it's going to start becoming a requirement this coming week that all the people in the office have a mask on, including the parents of the patient and the patient themselves. The current recommendations are 2 and above should be able to wear a mask. Now, we understand if there are some developmental difficulties or autism perhaps, and those children just can't stand that sensory feeling of having that thing on their face. We understand that, and we'll work with you. But we do believe in masks, and I just want you guys to feel safe in the office. Other practices are managing this situation in different ways. Some of them, I have read, do all their well visits in the morning and then do only sick visits in the afternoon with intense cleaning between individual patients and then another intense cleaning in the evening. We're also cleaning each exam room as if there had been flu in there, even though there hasn't been, even between every well check now. So I think everyone across the country is trying to be so careful to provide a safe environment so you can come and get your baby's vaccines and stay on schedule. So if you remember nothing else from this video, remember, we still want your child to get vaccinated during this pandemic against all the diseases that were already here before this novel one came along. So let's talk about masks a little bit, as they've become somewhat of a controversial topic. And guys, everything on this video is my educated opinion, and you're welcome to take it. If you have a lot of angry and hurtful things to say towards me, you really don't need to bother to leave a comment, because I'll just delete it. This forum that I created, this YouTube channel, is just for education and reassurance and encouragement for parents. It's really not meant to be a platform for debate. And so just know that going into that, you don't have to listen to me. But if you know me, I'm going to tell you the truth, and I'm going to be honest. I'm going to base it on both my education, training, and things that I've been reading lately. So we know that masks do work. I had eyeball surgery about 5 years ago. It was gross and painful and disgusting. But you know what? My surgeon was kind enough to me to wear a mask in the operating room. It wasn't because he was afraid of me. It wasn't because there was a massive governmental conspiracy to control his mind and put a microchip in him. It was because he didn't want the germs in his nose and his mouth to get into my eyeball. And guess what? I really appreciate that. If masks didn't do anything, why do surgeons wear them in sterile situations to maintain the sterility of the operating field? They do it because they don't want any respiratory droplets to come from their nose or mouth and contaminate that sterile field. Now, I'm not crazy. I know we're not going to maintain a sterile field at Walmart or in your grocery store. I get that. But could the mask prevent some large respiratory droplet spread? Certainly. So some parents ask me, well, then why did they initially tell us not to use masks and now the CDC says we should use masks? There are a lot of reasons around that. One of them is initially, well, and somewhat ongoing, but not as severely, there was a huge shortage of personal protective equipment, or PPE. When there was a limited amount of PPE, we needed to reserve it for frontline healthcare workers who were actively working and taking care of patients even without proper PPE, and were catching this virus, and even some of them sadly lost their lives due to this. So we had to sort of prioritize early on and keep the PPE for the frontline healthcare workers. Well, fortunately, that's not as big of an issue. It's still an issue, but not nearly as big, and there's much more PPE available now. Also, over time, we've had a chance to sort of catch up, and there are all sorts of ways to make a cloth mask you can make at home if you don't have access to a surgical mask. Now, there are still limited N95s, which are probably the very best, but also extremely uncomfortable, I can tell you that. So surgical masks seem to be a very useful and not quite as painful thing that you can use to protect yourself and protect others. The biggest bulk, though, is protecting others from you and your respiratory droplet spread of infection. Now, this is one thing, it's a little bit tricky because in many areas in life, I'm sort of a libertarian. You do your thing and I'll do mine, and we'll all get along together, and we're all in this together. Yes. However, masks are a little bit different because masks are, this is how I think of it. The masks are the way of you showing a society, you showing your fellow grocery store shoppers that you care about them because you are attempting to keep your germs to yourself. Now, if you are just not very bright about using your mask, surely it's not as beneficial. I saw the cutest thing the other day, and it said that you should think of your cloth mask much as you should think of your underwear, okay? If it's a cloth mask, you should wash it regularly. You shouldn't handle it in public. You wouldn't handle your underwear in public. If it has a hole in it, change it. If it's wet, if it's soiled, change it, okay? So if you can't remember how to properly treat your cloth mask, just think of it as your underwear. You wouldn't change those in public. You would leave them on the whole time you were in public, right? And we would appreciate that very much. So I have to say I'm decidedly on the side of everyone wearing their masks. Just try to wear them properly. If you're constantly keeping your fingers on your face or touching the outside of your mask, that's certainly not the goal here. The goal is to put it on properly, covering your nose and your mouth, people. I have seen so many people out and about with their mask around their mouth and not their nose. Not effective. It's not effective hanging off one ear. It's not effective under your chin. It needs to cover your nose and your mouth, and you need to not handle it. And then it can be effective. And there have already been studies demonstrating decreased infectivity rate in folks who completely wore masks all the time, such as in Hong Kong, who have done a good job getting their numbers down, probably partially because of compliance with everyone wearing masks when in public. I also want to explain something to you. A lot of people are thinking that since we're entering phase 1 and we're beginning to decrease some of the restrictions, which is welcomed for a lot of mental health concerns, maybe some domestic violence issues that are increasing, lots of economic concerns in small businesses that have truly been suffering. I get all of that. But just because we're changing phases, it doesn't mean that suddenly the virus is any way less virulent or less contagious. It's out there. It's just that we have successfully flattened the curve. Now, maybe not in New York City, but in less densely populated areas, we're not seeing a run on the ICUs and the ventilator like we were afraid would happen, and like did happen in Italy and New York City and other densely populated places. But it doesn't mean that the virus isn't still there. All it means is that there is room for people in the ICU. So I need for you to keep that in mind. And if anything, that should encourage you more to limit big crowds, limit shopping trips, limit unnecessary travel, and always wear your mask and always wash your hands carefully, or keep some hand sanitizer available as you're going through the grocery store. And once you get back in the car after buying your groceries, just use it liberally to kill all those germs that could be on your hands from shopping and touching things in there. I hope that makes sense. Then another thing to update you on with children specifically, it's still true that they are very rarely at risk from this particular virus, which is awesome. But there have been some cases in children, obviously, very few and very rarely fatal, although possible. But there is a new syndrome emerging that has been described in children, even post COVID-19 infection, and that is some sort of a multi-system inflammatory syndrome that reminds us of Kawasaki's. But right now, the criteria for diagnosis is just 24 hours of fever, which is tricky because Kawasaki's for diagnosis has to be 5 days of fever. So we're still struggling with, do we treat it the same as Kawasaki's? Do they get aspirin? Do they need an ultrasound of their heart? Some of this is still all up in the air. So I just did want you to know that was one of the pediatric updates for that. And then if you would just be generous with me and gracious with me, let me vent a tiny, tiny bit. And remember, I want all of this to be received in love. I want people on different sides of this debate to reach out and love one another. But can I just tell you from a personal standpoint that it is very hurtful to healthcare providers, especially physicians, when people post the most ridiculous things on Facebook saying that we physicians, now understand, I'm not in the intensive care unit. I know you haven't accused me individually of falsifying billing records to say they had COVID-19 when they didn't. But I did train, and I do have friends who are there, and it's just so hurtful for people to randomly accuse physicians of changing the billing intentionally to make more money. So first of all, you should know, I don't know any physicians whose individual income is based on how much they charge. They're typically, if they work in the hospital, an employee of the hospital. They don't get bonuses for charging more. And the posts that I've seen make it sound like, oh, you just charge them for being intubated. That's when the patient's placed on a ventilator and they have an endotracheal tube in their trachea to assist them with ventilation and oxygenation. Well, okay, first of all, there are very set criteria for when a patient needs to be intubated. I remember at least this much from my residency training, right? And so a physician would never intubate a patient who didn't need to be intubated just so they could charge them more for being intubated. So do you folks who post these hurtful things think that we want the patients to be sicker, or that it's not fair to charge them more if they were intubated? You must understand that an intubated patient is worlds more complex than a non-intubated one. They have to have a respiratory therapist at their bedside very frequently. They would automatically be in an intensive care unit and need almost one-to-one nursing and frequent rounds by the attending physician. I really just don't understand. The other thing that I don't understand is when people are so angry that the hospital maybe gets paid more because the patient did have COVID. You must understand that it's much more complicated to treat a patient with an unknown disease. We have made such strides in medicine thanks to our adherence to evidence-based medicine, right? So for pediatrics, for example, the survivability from childhood leukemia is drastically better than it was 20, 30 years ago because we use pediatric oncology groups, POG, or certain protocols based on the patient's initial diagnosis, right? And so we have to practice evidence-based medicine, but a lot of that ends up translating into some very good protocol-driven medicine, right? So if a patient presents with stroke symptoms, there are all sorts of criteria to get them on blood thinners, thrombolytics very, very soon, and that can improve their outcomes. All this is studied, and so some of our medicine is sort of protocol driven because that improves outcomes, right? We have none of that with COVID. Nobody knows. It's brand new. That's why it's called novel. So if the billing code for COVID is slightly higher than a standard bacterial pneumonia, well, it ought to be because it takes much more manpower and brain power and time and hours and consulting with other specialists across the country and trying to form these relationships with other providers in ICUs in other countries who have treated patients and what worked and was successful. So you must understand, first of all, that billing is complex to start with. Even in our office with pediatrics, just basic outpatient pediatrics, we typically have a sort of a continuing medical education around billing about once a year because it's so complicated. So how could it not be complicated to have intubated patients in the intensive care unit with a novel virus? Of course it is. And of course the complexity of the medical decision making should drive the level of the billing, right? Anyway, that was just my little rant. I'm so very sorry. And like I said, if I made you too angry, please don't leave a comment, but you don't have to watch the rest of the video. Thanks for watching to this point. I would very much like for you guys not only to like it, but to subscribe to the channel, and I'll have updates as they seem to be necessary. And of course, most of the time, just routine medical advice as usual. Thanks.